From the WRAL News Studios in Raleigh, North Carolina, this is the WRAL Daily Download, an in-depth conversation on a story worth talking about.
Welcome to the WRAL Daily Download. I'm Amanda Lamb. In today's deep dive conversation with WRAL reporter Joe Fisher, we're going to talk about where the monkeypox crisis stands. Joe, welcome to the program. I know you've been on this from the very beginning. You've been doing a great job keeping awareness about this public health emergency high, putting pressure on local health officials to act. Let's start by giving people a primer, if you will, on monkeypox. So if you're not familiar with it, what is it? How is it contracted? What are the symptoms? And how long do they last?
Well, thanks so much for having me. And I think I want to start with the number one misconception about monkeypox, which is that this is a sexually transmitted disease. Monkeypox is a disease that is really spread by close, really intimate skin-to-skin contact. And because that's how it spreads, really anyone in theory can contract the monkeypox virus. But it is important in this current outbreak to point out that much of the virus is spreading during sex, even though it is not a sexually transmitted disease, and is spreading very largely among gay and bisexual men and transgender people. So that's where we've really seen the response focused. And you asked about symptoms. The initial symptoms of monkeypox are rashes that pop up on the body. These rashes kind of go through several stages that resemble maybe pimples or blisters. And some people have reported experiencing fever, chills, and other flu-like symptoms before getting those rashes, although that's not always the case either. So this is really on a case-by-case basis. And these symptoms last a long time, 2 to 4 weeks. And during that time, people have to isolate so as not to spread it to anyone else. And I also think it's important that after exposure to the monkeypox virus, it can take up to 2 or 3 weeks to even start experiencing symptoms, which is certainly making it harder to contain it.
Absolutely. And a lot different than COVID in that it's not as deadly, but it's definitely something that would have a big impact on your life, given the amount of time you have to quarantine.
Absolutely. I think people are having to isolate even longer than COVID. And it's really important that we stress this is not COVID. And this really has not risen to the level of a COVID response. It's not spreading nearly as quickly. And the good news is that a lot of doctors that I've spoken to, they say that it's actually taking a lot more than initially thought for this to spread, which is why we have not seen the numbers across the country spiking to the level of what COVID was.
Obviously, yeah, that's a good thing. And, I was looking at some of the CDC numbers, and of course, this changes daily, but the most recent ones I saw had about 22,000 monkeypox cases in the US, about around 400 here in North Carolina. And again, who are we seeing contracting it? I mean, this is primarily men, correct? And primarily, as you said, men who have sex with other men.
That's true. And North Carolina is reporting very similar to what the CDC is reporting, that almost all of the cases are among men who have sex with other men. And in the medical community, they call MSM, men who have sex with other men, as the highest risk category for monkeypox right now. We do know at least 7 women and 2 children have contracted the virus in North Carolina, but that is a really small percentage. And we've really spent time going over the case numbers in North Carolina. And just within our state, 40% of cases, so we're talking 4 in 10 cases, are being reported in Mecklenburg County, which includes the Charlotte Urban Center. And that has really been the epicenter of North Carolina's monkeypox outbreak. That being said, more and more counties are reporting this virus every single week. 53 of the 100 counties in North Carolina now have confirmed monkeypox cases, which has been increasing every single week for about the past 3 months.
And if I'm correct, the first case was reported on June 23rd. Like you say, it's steadily risen. And here in our area, Wake, Durham, Cumberland, They started vaccine clinics, but they were a little slow to react, correct? And why do you think that
I think
was?
local health departments will tell you that they are really reliant on the state to send them additional vaccine, and they weren't really getting that much vaccine in the beginning. The state, on the other hand, is reliant on the federal government to send them vaccine. So there is this sort of trickle down system, if you will, much like what we saw with the COVID vaccines. Doctors, I would say, have been pretty critical of the federal government, not putting this so much on local health departments or even the state health department, but the federal government specifically for not acting fast enough to secure more monkeypox vaccine from the very beginning. Other countries, especially in Europe, were buying up all of this vaccine in the very beginning. The United States has started to order more and more vaccine. I think they would like some 7 million vials expected by the middle of next year. But again, this is coming in ever so slowly and then being trickled down the system. There's no question that the US government at this point is concerned about the supply of vaccine. And in early August, the FDA actually changed their whole method of vaccination, which actually allows doctors to use a single vial of vaccine to vaccinate 5 people. And this is what we've heard in the news being referred to as dose splitting. So the people initially vaccinated for monkeypox in the very beginning were given this full dose. They were given a whole vial in the arm, much like what we saw with the COVID vaccine. And now people are getting 1/5 of the vial, and it's being injected intradermally, which is right in the forearm area above the wrist, about 6 or 7 inches. And it's given in the very top layer of skin. Again, it's 2 doses. This is a month apart, but people are now getting less vaccine. And doctors haven't really seen enough data at this point to know if that is the best method or not. And that's just really what our country has had to switch to because of the low supply.
Yeah, and it looks like North Carolina has given out about 13,000 doses at the latest count. But I noticed in one of your reports, you talked about how this has been done somewhat inefficiently and cumbersome, and people have been trying to get, vaccines, and they call and they get frustrated because they don't get to the right people. Has that improved?
I would say that it has improved slightly, but the vaccination effort has fallen largely on local health departments. If you think about it, if you live in Wake County or Johnston County and you need a vaccine, who are you going to call? You're either going to call your doctor's office or the local health department. And it's fallen on these providers, let's call it the Wake County Health Department or a doctor's office in Wake County, and they are really reliant on other people to get that vaccine into their clinics. And they only have a certain amount of nurses and staff. In Wake County, we did see longer wait times initially. Those have reduced a bit, and they have put additional resources recently into their vaccine clinic over there in Wake County, adding several nurses to speed up the vaccination. Really, no vaccines going unused at this point. That's some good news. It's more about getting those doses out quickly to people at high risk. And again, men who have sex with other men and transgender people who are sexually active are at the highest risk. And I think the strategy moving forward here is to hold more pop-up clinics, to push out this vaccine a little bit faster, and to take the vaccine into specifically communities of color, which have been disproportionately affected by the monkeypox virus.
Well, we'll talk about that in a moment. We'll be back after the break with WRAL reporter Joe Fisher on the WRAL Daily Download. Welcome back to the WRAL Daily Download. I'm talking with WRAL reporter Joe Fisher about his extensive coverage of monkeypox here in Wake County and across the state. And Joe, just before the break, you mentioned that statistic where Black men are contracting this at a much higher rate. I think it's something like 68% of the people who are getting this are Black men, and most of them are gay or bisexual. Do you think that the who is getting this is affecting the response because people are saying, "Oh, well, this is a gay disease. It doesn't affect me."
I think just by nature, the gay and bisexual community is smaller than the overall population. And really, from the beginning, the monkeypox response was never really treated like a COVID type response. I think some doctors have been critical of the federal government, saying that, the United States was not nearly as aggressive coming out of a 2+ year pandemic in securing vaccines, standing up testing, getting the vaccines out quickly. But taking a step back, I don't think that the response necessarily was affected specifically because of gay and bisexual men contracting the virus. But I do think the public perception has and still does have people writing off the seriousness of the virus. And that has really lingered on. And now we're over, like you mentioned, 20,000 cases in the United States, nearly 60,000 cases around the world. And the good news is that this is not COVID. And, even with all the cases, it's taking a lot more to spread than doctors initially thought. So this is not yet spilled into other communities outside of the MSM community. But I do think that people's perception of this virus has definitely been altered because of who is contracting the virus.
And as you said, very few women and children getting it, but there are some.
There are. In North Carolina, 7 women and 2 children have tested positive for monkeypox. And the state, as far as those children go, say that they are older teenagers. So we're thinking 15, 16, 17 years old. About 250 women across the country. So this is very, very rare. But it can happen, and anyone can get monkeypox. That's kind of been the messaging from health officials, from the CDC down to North Carolina, that anyone can get monkeypox. This is spread by close, intimate contact. But right now, the outbreak is centered largely around that MSM community.
And I know there's been a lot of concerns about college campuses and, for good reason. I mean, kids, I have a college student, they go to parties, they're dancing, they have close contact with one another in these settings. Have you seen a response from the universities? I mean, are they concerned? Are they holding clinics? Do they have enough vaccine?
I would say that universities are watching this closely, but I don't think they are overly concerned. I talked with some people at UNC Chapel Hill this week, doctors who say they're not seeing any significant spread in the first couple of weeks of classes. And so I don't think the word concern is the best kind of attitude to take. I think that they are just watching this really closely. But when you think about how the virus spreads, you would almost think a college campus would be a breeding ground for this type of virus, with skin to skin contact, perhaps a hookup culture of sorts. But we haven't seen that. So I do think that there is some concern. We have seen health departments giving vaccine to college campuses. I know NC State, Duke, UNC Chapel Hill, they all have doses of vaccine available. But again, those doses are in short supply.
And I know one of your most recent reports talked about the correlation between people getting monkeypox and people who are HIV positive. I think it was like 50% of those contracting it had already been diagnosed with HIV. Any understanding from the medical community at this point as to why? I mean, is there a vulnerability there in people who are HIV positive that they might be more susceptible
This
to
is
it?
a tricky one. Doctors are really trying to figure this out. Even the CDC is working to figure out potential links between those people living with HIV and monkeypox. They did put out a study recently that said people living with HIV, if they do get monkeypox, so if they're exposed to the virus and they get symptoms, they are twice as likely to be hospitalized. Well, what does that mean? It means that if they test positive, they have a really good chance at having a more severe case of monkeypox. But actually getting the virus, are they more vulnerable? That's what is really still unclear. And the medical professionals that I've spoken with say that this is more likely a result of their individual behavior, in this case, sexual behavior, not so much the fact that they are HIV positive. And many people living with HIV have immune systems that are just fine. And then there are people with suppressed immune systems, or those who are perhaps not properly medicated. And those people with not as strong immune systems are more likely to have a serious case.
And before we wrap this up, Joe, I mean, what should we do? What can we do to prevent the spread of this? Especially if you think you might have been exposed or you have a potential to be exposed. I mean, what should people be doing?
I think it's important for everyone, regardless of who they are, always to pay close attention to changes with their body, how they're feeling, what they're seeing. And with monkeypox spreading, state health officials are saying, get checked, get tested, and get protected. So if you have a rash or a pimple that becomes really painful and you're in a high risk group, get tested. And testing has really come a long way from doctors' offices to health departments. Get tested. And that testing is really helping to minimize the spread as we try to contain the virus before it spreads to perhaps other populations. So get tested and get vaccinated if you're at high risk. North Carolina just expanded its eligibility for who is at high risk. Of course, gay and bisexual men who are sexually active or transgender people, but also even if you are someone who knows someone who has had monkeypox recently and you've been in close contact with them, you are now eligible for the vaccine. I guess I'll leave you with just a bit of hope, and that's from really everyone across the board that I've spoken to, that in time, this virus will hopefully start to decline, and hopefully sooner rather than later, and that with widespread vaccination, it will really help people who get monkeypox to reduce their symptoms. So I think from the trends we're seeing now, either cases are plateauing or even starting to drop down in the United States. I would say that there's definitely some hope in terms of the monkeypox outbreak.
Joe, thanks so much for your insight today on this important topic. This has been the WRAL Daily Download, a production of WRAL News. Check out my 2 true crime podcasts. What Remains focuses on solving cold cases and forensic science. Follow the Truth is about the murder of Michael Jordan's father in North Carolina in 1993. Find What Remains and Follow the Truth in your podcast app.